Hey y'all, this is Chris Hudson, your physical therapist. Came across a really great article that I wanted to share with you guys. It's called BSI. It stands for Bone Stress Injuries. And this is particularly for long distance runners. So who's susceptible to developing this disease? Well, they found that 1/3 to 2/3 of cross-country runners in high school and college are susceptible to this injury, as well as novice runners, and even up to your more elite type runners are susceptible to this injury. So everybody is susceptible to this injury, and it does occur because I've seen it in our clinic more than just a couple times. So what happens when you have BSI is, as you start to run a lot, you start to actually break down the bone, and then there's Wolff's Law, which says that the bone actually will adapt to its environment. So as a result of running long distance, the bone actually gets denser, harder, and the bone is much stronger. But what happens if you're not training correctly, and there's a variety of risk factors that I'm going to go over here, you actually continue to break down the bone quicker than it can build itself up and recover, and consequently you will develop BSI as a result. Typically, what you experience here is a very localized tenderness over the bone. Typically, the shin is one. And then you can also gradually progress to having a stress fracture and even a compression fracture.
So what are the risk factors of BSI? Well, the first one is poor body mechanics running. Besides striving for good mechanics to help you run faster and more efficient, having the combination of excessive forces just from running alone on the bone, coupled with malalignment due to poor body mechanics of the lower extremity, this puts excessive stress on the bone, which could predispose you to developing BSI. There also seems to be a relationship between runners that heel strike and BSI, and it's because of the quick load placed on the bones and joints compared to runners with more of a midfoot or forefoot gait pattern. So you may need to change your running gait pattern if you seem to have reoccurring BSI. That could be part of the problem for you. Runners with feet that have high arches or low arches also seem more likely to develop BSI. So number 2 is training factors. Progressing a running program too quickly, which means going out for runs that are too long a distance compared to the distance you have been used to running, and running, maybe it may also be even running too frequently during the week, which also puts excessive stress on the bones, and consequently the bones can't adapt to this change in stress. Sudden increases in running speed could also cause you to develop BSI. So as we start running faster, naturally the amount of ground reaction force also increases, which means you could be advancing your running workouts too quickly. The third factor is muscle weakness. So one responsibility of the muscle is to move you. The other is to protect the joints and bones that are being placed under stress while you run. So this means that muscles should be acting like a shock absorber for the bones and joints, and they are having difficulty responding to that stress because they're actually not strong enough to do so. So when muscles are too weak, particularly the gluteus maximus, gluteus medius, and the quads, to withstand your running program and maintain good form, this puts extra stress on the bones, and the bones can't adapt to that. The fourth factor is running surface. So running on a harder surface such as asphalt and cement increases the loading compared to a more softer surface like grass, rubber, or like a rubber track, or even trails and sand. The fifth factor is running shoes. Your shoes could be losing their ability to absorb shock, and my questions to you guys are you changing them frequently enough? Are you tying and untying your running shoes, or just jamming your foot into your running shoes when you're going for a run? Because this prematurely breaks down your running shoes. Are you wearing your running shoes for other activities than just for running? Because this also can prematurely break down your running shoes. I do have a great video on this channel y'all should check out in regards to running shoes. It's called Rules for Wearing Your Running Shoes and When to Change Them. And it's it's got a lot of good information on there about running shoes and actually when it is important to change them so you guys can keep running healthy. And then the sixth factor is energy availability. Are you eating enough calories during the day to give your body the nutrition it needs and to rebuild and get stronger? So this doesn't necessarily mean eating lots of pizza and ice cream, even though that stuff is really good, but eating more of a well-balanced meal. And in your diet, are you getting enough calcium and vitamin D? Females are more susceptible to developing BSI compared to males because they don't typically get enough calcium. In one study in this article, it showed that women who eat 800 milligrams of calcium or less per day were 6 times more likely to get BSI than those women who ate 1,500 milligrams of calcium per day. So what's recommended is to take or exceed about 1,000 milligrams to 1,300 milligrams of calcium and 600 IUs of vitamin D for runners between the ages of 14 and 50 years old. So which bones are the high-risk bones to develop PSI? Well, one of the first ones is the femoral neck, and this one isn't actually palpable because it's located under a lot of deep muscles in the hip region, but the pain would be coming from the groin region. Another, which is the most common, is the tibia, also known as the shin bone, and this occurs, and BSI occurs at least half the time in the tibia, and the pain is located over the anterior or the front of the shin bone here. Another common site is the medial malleolus, which is the inside part of the ankle bone. Another very frequent location is the talus bone, which is a bone located on the front of your ankle bone. And you also have a fifth metatarsal bone, which is it's the outside bone in your forefoot, which is also another common site.
So if you know that you have BSI, the most important thing to do, or you think you might have BSI, the most important thing to do is to go ahead and just lay off running for a couple days if you can. You can cross-train if you want to, but stay away from high-impact type of activities, maybe swim or bike or something like that, just to change it up. And then go out for another run a couple days later, and if you still develop that bone pain, it's likely that you do have BSI. And you should, at that point, cease running and actually either go to your family doctor or to your physical therapist. If you go to the family doctor, they'll do things to try to help confirm that type diagnosis. They also may choose to do some imaging. In the first line of defense, typically what they're recommending is that you do an x-ray, but the x-rays really have a low resolution, so it's kind of fuzzy when you look at an x-ray, and it's not real definitive if you have BSI. It's even kind of hard to rule out some stress fractures with the x-ray. The next thing that the physician may recommend at that point is to go ahead and get a CT scan, but that's not really recommended either. It is good at diagnosing it, but you expose yourself to a whole lot of radiation, and I think it would be more important to just take a break from running at that point than expose yourself to that much radiation. But what is highly recommended and seems to be the gold standard to rule out or rule in the possibility of having BSI is an MRI. And the MRI is very high quality, and it's very good at being able to make this diagnosis. So when you would eventually go to a physical therapist, or if you chose to go to a physical therapist, that physical therapist should really do a thorough examination on you, and what that would include is assessing your range of motion, your flexibility, your strength. They should have you, if you're not in too much pain, have you run on the treadmill to do a running gait analysis. Something else important to do during the eval and throughout the care that you're receiving is to talk about your running program, talk about when these symptoms started to occur so you can try to pinpoint what exactly it was during your training program that seemed to contribute to causing these systems, this problem. And then as you are going through your rehab, the major focus there is to focus on core, lower extremity strengthening exercises, and particularly foot strengthening exercises as well. All these type of exercises should be low impact. But in addition to that form of treatment, you should also be trying to maintain your cardiovascular system. So in the PT clinic or even outside the PT clinic, you should continue to perform some type of cardiovascular exercise, which could be swimming, it could be the rowing machine, and it could also be biking, which would all help to maintain your cardiovascular condition. And then again, as you continue to receive treatment, you just should discuss how you're going to modify your training program so that you can run more healthy and prevent this kind of problem from coming back again. So during part of your rehabilitation, you might be trying to figure out when it is best to start running again. And what is recommended according to this article is to not start any type of running program until you have no pain with palpation, you're walking without pain, and you're off all of your pain meds. And at that point, you and your physical therapist can start tailoring a program that allows you to start running more healthy and more safe and return you back to running the type of workouts that you would like to. So if this video was helpful, give us a thumbs up. You can share it with all your buddies that might benefit from this. You can subscribe to this channel if you'd like to. If you live in the Lancaster, Pennsylvania area and you need some help with rehabbing this type of injury or any type of running injury, I'd love to help you. And what I'll do is leave the 2 locations that I am at so that you can contact me if you need any further care. Thanks a lot. Have a good day. See ya.